little good morning, good afternoon. It is Friday. I am super excited to be here again for my Friday Friends segment. I am super excited about that. So, for those of you that are new, my name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, founder and CEO of Tennessee Health Advocates, where we help busy, committed professionals take control of medical bills without the frustration of medical billing departments. So that's what we do over there. But on Fridays, I love to hang out with my friends. Love to showcase other advocates. Independent patient advocacy is a growing industry, and there's a lot of questions around what we do. So I love to invite my friends on and share what they're actively doing in the advocacy space. So today I've invited my friend Sylvia Reisman. She is a patient advocate in the Atlanta area, and I'm not going to tell you too much. I'm going to let her tell her story, but I will tell you this. In 2006, she did become mysteriously ill with some unusual symptoms and had to go from doctor to doctor and wasn't able to get a diagnosis. And we're going to learn more about what happened, what she did, and how she came to be an independent advocate. So without any further ado, Sylvia, thank
Hi,
you so
Nicole.
much for jumping on this morning. I really appreciate it. You doing
Thank
all right?
you. Yes, thank you so much for having me, Nicole. I'm excited to be
Oh,
here.
you're welcome. Yes, I'm super excited too. So I'm sure that there's a lot of folks out there who are wondering, what were these mysterious symptoms? What happened to you in 2006? So with I just go ahead and tell us your story, how you came to be where you are today as an independent advocate.
Sure, Nicole. So when I first became obviously ill in 2006, I was living in the Tampa Bay area. And I knew there was something terribly wrong. I had a wide array of symptoms that changed and moved around different areas of my body. It made no sense, but I knew something was horribly wrong. And as you mentioned earlier, yes, I ran from doctor to doctor within my, in-network insurance, physicians and specialists. And I really wasn't familiar with many of the physicians because I wasn't from the Tampa Bay area. So that made it challenging as well, not knowing who really I could go to. But in a nutshell, after almost 5 years of trying to, get this diagnosed correctly, and I actually saw physicians both in Florida and Georgia, two states,
Mm.
ranging from Savannah, Atlanta, Tampa Bay, Sarasota, St. Pete, and the list goes on. Um, I finally actually self-diagnosed, but then confirmed with a highly specialized test that I brought to a physician in the Tampa area who graciously ran the test for me. But even then, he actually misinterpreted the test results. So I called the lab company in California, and that's when I confirmed that I was positive for Lyme disease. And I didn't fault the physician. He was a nice man. I actually reached out to him a few weeks later to let him know that I was positive. And first it shook him up, of course, but I explained,
Sure.
I understood that he'd never run the test before. It was, like I said, a specialized test panel. And so, I just let him know because he needed to know. And then for future reference that he could call the company in California if he needed assistance with interpretation. So
Wow.
so that's what happened. Yes. And
Wow.
that's what became my driving force behind starting my patient advocate practice.
So my goodness, so it took 5 years and you were having these crazy symptoms for 5 years. And so did we talk about what the actual final diagnosis was? Like what
Well,
did they actually come back and say you're positive with?
it was Lyme disease. And then I actually took the test results along with other tests that I had run. Had moved back to Savannah from Tampa when I, received the test results from that specialized Lyme panel. And then I ended up going to see a Lyme specialist in New York City. And late 2011, took the tests along with other tests that I had run, and then saw him for a few years. I would fly up to New York about once a year and then have phone appointments. But that was actually one piece of my puzzle. At the time, I thought this is it. There were other things that came along with that. And then in addition, my journey was over 12 years.
My goodness.
putting together the puzzle.
Wow. So that's insane. So tell me a little bit about like what did you learn on this journey? Like now you're an advocate. So how did you take this experience and how do you use it today as an advocate and tell me a little bit more about that.
So, of course, as many of us know, our conventional healthcare system is fragmented. So, if you are complex like I was, chances are you're not going to be able to get a correct diagnosis within our conventional healthcare system because each specialist is focusing on their one organ system. And then, no one's putting it together. Nobody's coordinating it. Nobody's spending the quality time because of the time constraints as well as these individual specialties. And so that leaves someone basically they're left to suffer or go down the rabbit hole. So what I've done is from what I've learned is number one, for complex patients like myself who either maybe they've gotten diagnosed with something or multiple things, and they were a highly, active person. Most people this happens to are people who are extremely active, their lifestyle, they could be eating very healthy, doing all the right things, and then bam, their life changes overnight and they just want their life back. Their quality of life is gone. So what I've learned is I put together an in-depth assessment. And my assessment is, I put it together based on my personal journey, both learning from the mistakes that were made, as well as learning. I follow and learn from some of the top functional and integrated medicine physicians because, again, every person is unique. We can't look at people like a McDonald's menu. I want a hamburger, fries, and a Coke. You can't do that. And we have millions of people, and in particular women, who are invisibly ill. A lot of them have, been diagnosed with chronic fatigue syndrome, fibromyalgia, lupus, and they get all these different, diagnoses, but that's not really the root cause of what's going on. And so they don't know what to do. They're just out there. Some accept their diagnosis and some who, might be like me, like, no, there's something wrong, And so that's why I'm here to put that puzzle together. I'm here because that is my assessment actually looks to identify areas where the physician or physicians have overlooked because of the time constraints within an appointment, and because many of them are not trained on how to diagnose a complex illness. And so that's what I do, is try to identify those areas to help my client say, okay, here are the areas, and it's a 3.5-3 hour interview that I go through with the client. And then out of that come the areas that have been identified that they may wish to explore. And if they choose to continue on with me, then I can help them research for physicians, which would include looking at functional or integrated medicine. Because when you're a complex case and you haven't been diagnosed correctly, chances are you're going to have to incorporate either functional or integrated medicine into your plan of action, which this plan of action is what that I help them create.
So Sylvia, this sounds like it's a really niched area of advocacy that you've tapped into. Tell me, like, do you only work with Lyme diagnoses, or what other, like, how do you describe your specialty inside of advocacy?
So my passions are, of course, what I just mentioned, the complex area, but also seniors, because I was an advocate for both my parents as well. And my father was a 5-year survivor of pancreatic cancer. Although I don't specialize in the cancer area, although I spent years researching it back in the early days of the internet. I was on the Johns Hopkins board all the time for my father. So, but no, seniors, and I focus strictly on outpatient navigation, meaning the doctor's office. Because if you think about it, everything starts at your primary care doctor's office. If you have a great relationship with a primary care doctor and you have collaboration and you have open dialogue and communication, that's what you need. But if you don't know what to ask, you don't know what to do, or you feel intimidated, down the road, you could end up in the hospital unnecessarily. So I'm here to try to proactively prevent that from happening, because you don't want to be in the hospital. And that'll be one that we could touch on that in just a minute. But I mean, we can't completely avoid the hospital, But in many cases, if someone's not managed properly from the get-go in the primary care, then that leaves the door open for you to end up in the hospital. So my seniors, I help them prepare for appointments. This might be someone who's living alone, or it could be someone who has an adult child in another state, or maybe they're just too busy with life with their own family, and they're concerned about their parent or their loved one. And so that's, like I said, I can attend appointments locally. I can also attend, telehealth. And then also I'm there, to be there, to be their voice, to help them ask the questions if they're not comfortable, to help them understand their diagnosis and help them research for treatment options, as well as second opinions, because second opinions, I preach on that because of the misdiagnosis rate. We have a very high misdiagnosis rate at the outpatient level, and I think it's much higher than what Mayo Clinic has quoted, which is 12 million people a year. 12 million people a year outpatient are misdiagnosed according to Mayo Clinic, but I believe it's much higher.
Wow, that's crazy. That's insane. So I just kind of want to go through and recap here, because I think it's really important that anyone that's listening knows exactly who you help, so that that they will know for sure. So I'm hearing you say two general populations. One is it specifically women that are having trouble with symptoms and identifying a diagnosis and getting support and help, or is it anyone that's experiencing
I can help
that?
anyone. And usually women are the ones, we know our bodies, and we usually are the ones who want answers. And there are men out there who may be in the same situation. I certainly can help them as well. But usually the focus is women, only because that's who usually calls me. Or it could be that the wife calls because the husband's sick. And that's usually how it is. Women are the ones with, we're the driving force, whether it's for ourselves, our spouses, our parents, our children.
We do
certainly would help. I
role,
certainly would help men if they needed help.
Perfect. Okay, so if they're having symptoms, cannot identify the root cause and what's happening, this is where you do your deep assessment, and really that's that 3-hour assessment where you get in there and really help them locate that issue and get the team on board, I assume, that can help them and help them find specialists and that kind of thing. Is that part of that as well?
Yes. So I give them an option. The first option is they can either take the results of the assessment and the plan of action. If they want to go out on their own and try to find physicians on their own, they can do that. Or if they want to continue on with me, then I offer them the option for someone who has taken the assessment, that they can continue on with me. And I actually have what I call blocks of time if they want to purchase blocks of time, because it's very hard to know how long will it take, to be able to get the care they need, and, and what help I might be able to provide them that they need.
I love this. I provide this too for my clients, where we do this in-deep consultation to really get into the nitty-gritty of things, create an action plan that they can then self-execute. They can execute with my support, or they can have me do it. So it sounds like you do the same type of thing with that assessment, right?
Yes. And I think it works very well to give, give clients options, because, people want an option, and like you said, and then if they go out on their own and they try it, and sometimes it doesn't work, and they come back, and that's okay.
It's totally okay, because now they have the resource, right? And knowing where to find the answer is so important. So I love that. So that's the one section that I hear you talking about helping. And then the other one is this this caregiver for the aging population. But it sounds like you can help not only the adult children, but then the aging parent as well. Is that right? So there's those two. Is this the second batch of folks that you help? Is that right?
Right. So it would be, like I said, either someone who might be living alone, and they don't necessarily have to be a senior. I mean, there could be somebody who's 45 living alone, but if you said, if an adult child has their parent, they have parents who either are living in another state, here in Georgia, for example, and the adult child is, say, in Tennessee, and they need someone who they can trust to be able to navigate their loved one to the doctor's office because, let's say, for example, they're concerned because, over prescribing is becoming a huge issue because of going to different specialists and just saying, hey, here's a pill, because that's the conventional system. It's not about finding the root problem. It's like, what's your symptom? Here's a pill. Next thing you know, they're on several different medications. And if they're by themselves, they could fall, or just any number of things could happen, So that's becoming a huge issue. And I'm on LinkedIn. I'm linked in with a lot of pharmacists,
Nice.
having these conversations. In fact, one of them is in Massachusetts, and she's written a book on how to deprescribe. So this is something that's, so I work with, again, the adult children to help their parents, whether they live local or they live out of state. I could certainly help the adult child if they needed help as well. Sometimes that happens. And I just spoke to the pharmacist who wrote that book. We had that conversation this past week. How it comes out sometimes that the adult child, is overprescribed when you're actually there to help the parent. Right. So it's amazing,
That's crazy. So I would love to hear about, are you familiar? I've seen this happening on LinkedIn here recently. I've seen people biting into limes. Do you know anything about that?
I absolutely do, Nicole. So back in 2015, I was with a group of individuals all over the country, and we came together. Every one of us had been diagnosed with Lyme disease or had family that had been diagnosed. And we decided to collaborate to execute a global social media campaign to raise awareness of Lyme disease and provide the facts, because there's so much information out there. It's unbelievable. There's such a lack of education. People have no idea. And a lot of times people just believe what they read, and it's not true. It's, a lot of myths, such as, okay, you have to have a tick attached to you for 36 hours or whatever to get Lyme. This is a complete myth. It's just an example. So what we did is we were out on Twitter, Instagram, and Facebook, and we were challenging, just like similar to the Ice Bucket Challenge. We were challenging celebrities, media, everybody. And it was so exciting. I mean, I was up half the night because it would be 11 o'clock, ready to go to bed. And next thing I know, I'll cross Twitter. Here comes a celebrity in California taking a bite. I can't tell you how thrilling it was to see the challenges made. And we did this for 2015 was our first year, and it just exploded. And then we did it again about three years after that. So I decided to bring the campaign to LinkedIn for the month of May.
Nice.
So May is Lyme Disease Awareness Month. So if anyone out there is interested in participating, they can contact me through LinkedIn. Let me know you want to be challenged. I will be happy to challenge you.
Oh, that would be great. So much fun. Absolutely. I'm all about the fun. So yeah, let's do that for sure. Tag me, challenge me, do whatever we need to do so that I can be a part of that fun campaign.
I will definitely challenge you. We still have a few weeks left, and I will be doing some more video challenges, and I will challenge you, and I'll provide you with a link.
Oh, yay. That'll be great. That'll be great. So one of the things that I love to ask everyone at the end as we get finished here, I would love to hear, and I would love to give you the opportunity to share your favorite success story as an advocate. And I hear you've got a new one. So why don't you share that story with us?
Absolutely. And this one is like a wow moment. So again, I just mentioned to you why for this month on LinkedIn, I have been mainly focused on promoting awareness of Lyme disease. And literally 2 weeks ago today, and it's weird, I connected with someone. Her name's Jennifer. She actually lives in the Atlanta area. And I don't know, we talk about who connected first, almost like I'm laughing like a dating website, like who looked at who first? We're just joking about it. And I started I think I started following her. I think she came up, maybe I saw her looking, how you see people looking at you. And I thought, who is she? Where is she? I think I started following her first. But anyway, I think she liked one of my posts, and I ended up getting on the phone with her. I said, you want to talk? I saw her background was in sales, in some kind of health care or medical capacity. We got on the phone, and next thing you know, she's sharing with me what had been going on. And her story she just gave me permission to post her story yesterday, which is on my LinkedIn. So what she was suffering about a year ago, she started suffering symptoms. She was a very active person. She went from being a very active person, high functioning, to being a shadow of herself. And she started out, it was after a trip to, I believe her husband's family has a place near a lake in North Georgia. And so she started having all kinds of symptoms, including chronic fatigue, neurological symptoms. She was diagnosed with Ramsay-Hunt syndrome, which is a neurological condition that was affecting the nerves in her face. She had severe shingles in her, when it started out, severe shingles in her jaw. And she just had gum surgery in the past 3 weeks. And we were talking all these things. And so at some point I'm like, have you ever explored getting tested for Lyme? And I explained to her that the testing's not accurate. The conventional testing is 50% false negative. So I said, you could try it.
Wow.
You could try it, but if it comes back negative, it doesn't mean you're negative. So lo and behold, she went and got the regular test. And when you test positive on a regular test, oh, whoa, you're really positive, right? So she came back a few days ago. And again, she's very open. It's on my Facebook. She's given me permission to talk about it. She tested positive. So yeah. So all the stuff going on with her the past year, the Lyme disease. So she's pursuing, seeing someone who specializes in this. Yeah.
So after a year of all of these symptoms, she's finally going to get some treatment and hopefully some relief, right?
Right.
As a result. That's amazing.
Right. It really is, but it's just like this is happening to people everywhere, and they end up again in that fragmented system. And she knew something wasn't wrong. It didn't make sense, but she wasn't getting anywhere. She didn't know what to ask. All you're doing is going, why is this happening? And you're not understanding, and nobody's putting it together.
Right. Well, thank you so much for all of the valuable work that you're doing as an advocate. First for yourself, right? And then taking that information and that experience and now sharing it with others so that their journey is a little bit easier and lighter than yours was. I love that. And I love to hear your story, and I'm so honored that we're connected, and I'm looking forward to my Lyme challenge. And before we go, where is the best way for viewers to connect with you if they feel like they need some assistance or some help or some guidance that you could provide? How do they connect with you?
Sure. So if you're on LinkedIn, obviously you can connect with me on LinkedIn, and then we can take it from there. Or you can go to my website, which is Purity Patient Advocates with an S on the end.com. Nice. I also have an Instagram page, which is at Purity Patient Advocates. And I have a Facebook page, which is Purity Patient Advocates, LLC. And that's probably the best way. My phone number is 470-670-7667.
Perfect. All right. Well, if you want to connect with Sylvia, you've got all of the ways to do that. All of her social media, her website. You even have her phone number. So, Sylvia, thank you so much for jumping on and doing this with me today. I really appreciate it. You're doing some amazing work, specifically around this Lyme disease and complex issues and diagnostics and helping people get the answers to their questions. I love it. So honored to have you today. Go have a great weekend.
Thank you, Nicole. Thank you for having me on your show.
Thanks. We'll see you later, guys, next week. Bye.